Hello and a very good afternoon. You're watching News 9 Facebook Live with me, Adarsh Vepachedu. Well, it is Unlock 1.0 and the number of COVID-19 cases and the deaths also are only on the rise across the country. And as you may know it, especially in cities like Delhi and Mumbai, the number of cases are skyrocketing to such an extent that when it comes to the number of hospital beds, we may have a very limited number of them. So when it comes to cities that are registering COVID-19 cases that are peaking almost on a daily basis, home quarantine seems to be a better way to go about things, and we may eventually see that as well. So, with home quarantine almost all set to become a norm as we go forward, what are the kind of do's and don'ts that we must follow? What are the kind of steps we must ensure we take so that the people or the COVID-19 patients who are under home quarantine recover faster, and also so that the other family members staying in the same house do not contract the disease? So that is what we'll discuss in this brief interaction. I also have an expert lined up in the form of Dr. Satyanarayana, who happens to be a pulmonologist. We'll rope him in a bit and we'll seek his expert opinion as well as to how to go about home quarantine. But a few important things that we must keep in mind to start off with. Of course, we must ensure that the patient in question who's undergoing home quarantine at least gets about 8 hours of sleep. That is one thing you must start off with. And yes, when it comes to diet as well, that is something that patients must keep a close eye on. Adequate hydration is something that is very important, and maintaining an overall positive attitude also goes a long way. And this holds good not only for the patients who are under home quarantine, but also their relatives, their near and dear ones, their loved ones who share the space along with them. So these are a few broad points that could really go a long way in ensuring that home quarantine is a success. Now, one of the first things that experts have recommended is that while you have a mandatory 14-day home quarantine period almost in each of the states across the country, this quarantine period, that is 14 days at home, can itself be extended, and a longer quarantine period would never harm. It will only do more good, and that's one thing that we can always try and ensure in case if there are COVID-19 patients around us, that their home quarantine duration can extend. It is always good that it extends beyond 14 days. That is one expert opinion, and in fact the experts have indicated that it could go till as long as 28 days also, to ensure that the person in question is completely rid of COVID-19. So we are slowly going to a stage where people will begin to recover from COVID-19 at home itself, and all of this again goes back to the fact that the healthcare system is clearly not as much ready when it comes to the number of hospital beds, at least in dealing with the influx of COVID-19 patients. So a 28-day quarantine may be very ideal. And when it comes to vulnerable individuals, those above the age of 55, those above the age of 60, those with comorbidities, they should really be dealt with very properly. And when it comes to the special kind of drugs that they may use, like steroids, there needs to be proper care in everything that you're doing when it comes to dealing with those in the over the age of 55 years and those with comorbidities. So ensuring that these people are kept a close watch on is something very important. Obviously, immunity is something that plays a very important role, and doing your bit to ensure that the immunity is boosted in a certain patient who may be undergoing home quarantine is one way to ensure that you're keeping COVID-19 at bay, and also that you're recovering from COVID-19 quite faster. So in fact, at this point, we could really call our expert, Dr. Satyanarayana. If you're able to hear me, many thanks for joining us on News 9. We're just discussing as to the do's and don'ts that people must keep in mind when it comes to home quarantine. So what would your first advice be, and do you somewhere down the line see home quarantining becoming more of a norm as we go forward in the country, Dr. Satya?
Thank you very much, Mr. Adarsh. Now, I would like to introduce home quarantine and another new term called reverse quarantine. Home quarantine is brought into for three particular categories. One is international travelers who come in. They will have 7 days of institutional quarantine followed by 7 days of home quarantine.
Correct.
As you said, longer the better when it comes to home quarantine. The second one is domestic travelers and travelers from certain states, and thirdly, individuals who are exempted. So these are three groups, and some of them are based on health grounds. They are recommended home quarantine. So in home quarantine, there are definite do's and don'ts that are set out by the government of Karnataka. All the available evidence points out to the fact that if there is a good cross ventilation, that is quite better. In fact, cross ventilation will reduce the contact time with the COVID, and also air changes will help in, it will almost work like a negative air pressure. More number of air changes is better.
So air conditioning is not something that is recommended.
Sorry?
Air conditioning is something that should not be done in that case.
No, there is a little bit of a myth with air conditioning. See, when we say air conditioning, if there is air conditioning, central air conditioning, that is not good. But air conditioning for home and room is not a big issue.
Okay.
But the gist of things is well ventilated, cross ventilated room. Always maintain at least 1 meter distance between the other person in the room. Preferably better to stay in a single room, single person per single room. Have adequate amount of hand sanitizer or provisions for hand wash frequently. You can use a pulse oximeter to monitor periodically your saturations.
Okay.
Then you need to have mask and also a disposable bin to discard the mask.
Right.
Your home family member who is assisting you ideally should be one single person, and that person should wear heavy duty glove while dealing with your soiled cloth and other things.
Okay. Okay.
Do not cross over to common areas of the house. Do not share linen, cloth, sofa upholstery, or come in contact with the elderly in the home. This is in gist about home quarantine.
Doctor, if I could ask you about the administration of hydroxychloroquine for those dealing with patients or people who must be in home quarantine, how recommended is that? And also the kind of do's and don'ts that people who are sharing this space with someone who is undergoing home quarantine must follow.
Yes. So the other when you talk about hydroxychloroquine, it is not recommended for home quarantine people. As far as I know, ICMR has not issued any new guideline in regards to this. Still the larger trials of hydroxychloroquine is going on, both for treatment and for prophylaxis. Now the important other things that one should do during home quarantine, since there is no magical formula to boost one's own immunity, it is important that any underlying chronic medical problems are taken care of.
Okay.
So how does a person in quarantine do that? Please opt for telemedicine. Consult your doctor or consult the telemedicine providers from major hospitals and keep your underlying medical problems taken care of optimally. So the The other thing is there should not be any, religious gathering or, welcome home kind of issues. No visitors coming into that home. So these are simple things. As far as family members, what they could do, one person could be designated in providing, door-to-door care and use barriers, hand hygiene, glove, whatever, when dealing with the, soil, linen, food, medicine, whatever, well, you're delivering.
Right.
And if in case of any fever, breathlessness, body ache, sore throat, do not neglect and get in touch with Aptamitra or Arogya Setu app. So these are simple things.
Dr. Satya, before I let you go, one last question. Do you see home quarantining eventually being replaced, in a sense, institutional quarantine being eventually replaced by home quarantine? Do you see that as a possibility as we go forward with the number of cases only skyrocketing?
If I'm not wrong, I think the government has said that, if you are economically underprivileged, economically challenged, institutional, quarantining can be done. But whenever there is provision, I think one should come forward and say, I'll do home quarantine. But home quarantine is being done with only one purpose, to limit the spread of a transmission in the larger community. Therefore, if you opt for home quarantine, please be meticulous about it, please be honest about it, and quarantining should be done in accordance to the guidelines.
Well, there you have it. That was Dr. Satya calling a spade a spade. Many thanks, Dr. Satya, for joining us and for sharing with us a few of your insights as to how to deal with home quarantine. Yes, it is an important phase in case if it is happening in any of your lives, and there are several do's and don'ts. While we just discussed a few salient ones, you might as well go ahead and make sure you're equipped with all the knowledge that you need in case if you or any of your loved ones are undergoing home quarantine. Do not hide any of the information. Make sure you communicate with the officials that you are undergoing home quarantine. And yes, while you're doing so, make sure that you take all kinds of necessary precautions. Make sure there is ample distancing and make sure there is good hygiene in place when it comes to the wearing of masks and also gloves. So it is a crucial time, and if in case you're going through a quarantine, immunity is really one thing you must keep your eyes on. Ensure that you do anything and everything that boosts your immunity, and that will really put you on the top of your game. Well, that's all I have for you in this brief interaction. I hope you've gathered a few tips as to how home quarantining should be done ideally. Well, I'll be back once again with another trending topic and give you a few of the insights, the latest expert inputs, and ensure that you are up to date when it comes to that. Many thanks for joining us on this brief interaction. This is Adarsh Vepachedu signing off.